Okay, good morning. We are continuing Hilchos Milah Reish Samech Daled. Today we are going to continue in Seif Gimel. Just a real quick shout out to Reb Oliver Friedman, just to clarify if it's been confusing regarding the 8 days of the children for counting. We're just going to do a couple things real quick. Is when we count, again, it's 8 days based on the baby's life. So obviously if he's traveling in those first 8 days, it doesn't matter if he crosses a date line or not. Basically the baby himself has to see 7 or 8 sunrises. Depends if he was born before or after sunrise. But a full 8th day of the baby's personal life. As far as sunrise and sunset on the day of, so again, the baby's own life, wherever he is in the world, he counts onto the 8th day. It's the same thing when you have to count 7 times 24 for the baby to be healed. But when it comes to, right now it has to be bayom. We have to do the bris during the day, so that's based on where the baby is physically on the first day and physically on the 8th day. Sunrise and sunset based on where he is right now at the time. Hopefully that was clear. And no one holds, as far as I know, of Rabbeinu Tam whatsoever for Hilchos Milah. So even if you're keeping, it says Rabbeinu Tam of, let's say, 72 minutes. So then, let's say it's Motzei Shabbos, even though you keep for Hilchos Shabbos, Motzei Shabbos, and you do Havdalah and everything after 72 minutes, it doesn't matter once the baby is born after what we consider Tzeis. Again, that's anywhere from, let's say, usually between 13 and 50 minutes, depending on where you are on the globe, on your latitude and where you are, whatever it is. Ask your local Orthodox rabbi what your tzeis is. But that's not relevant to Rabbeinu Tam. Also, when we mentioned about Hatafas Dam Brit, so...
Chassidim also?
Yeah, Chassidim as well. For Hatafas Dam Bris, then we mentioned, what's also common, people use like that little prick, the little lancet for diabetes. When people check for diabetes, you can use anything that makes a drop of blood. And regarding Metzitza Bepeh, so I did see in one sefer he mentions there's a machlokas, but as far as I know, as far as I've seen, as far as whichever moal I've asked, there is no such thing as Metzitza Bepeh when on Hatafas Dam Brit. We're about to get to, we're going to explain that momentarily, but there is no sucking, right? And let's continue inside. And just to clarify, just to show, when we're talking about the anatomy of the bris milah, the foreskin. So again, we know that there's basically 2 layers of skin, but it's not 2 separate layers or membranes that we're removing the foreskin. It's essentially all one. In other words, let's say you have a piece of paper, for example, and you fold it over. So the top is completely connected. So this is kind of like what you would call the or Priah and the or of Milah. Right, it's all the way around. That's your foreskin. Obviously, it'd be connected over here, so it looks like this. And in here, this is where the foreskin is around. This is where the foreskin is around the tara, the glands. And if you're going to use a probe to separate the two, you're going to put in that probe. That probe is like that metal stick that's got a little ball at the end, or it's just round at the end, so that it's blunt, so you don't cut any tissue, and you just stick it inside. And we're going to get to that, but when you separate it, you obviously can't go around in a circle because there is a gid, there's some kind of a ligament or a blood vessel, I'm actually not sure, on the bottom of the gid, and you don't want to sever it. So that's also why everyone knows it's cut at an angle, right? The anatomy is a little bit at an angle from a side view. But anyways, it's not an anatomy class, but that's, so you basically, you probe one way and then the other way, so that this way you don't cause any damage. That's between, when you're doing the probe, which we're going to explain, or we're going to see, that is done between the or Priah and the glands. Because here it's completely sealed, it's folded over. But obviously when you cut this off, then you're going to be left with 2 layers. So obviously the outer layer, where the goal is to have it completely removed, and the inner layer, so that we're going to talk about as we go on. Do you want to cut the complete inner layer at the same time as the outer layer? And that's what people call Milah and Priah bevas achas, all at once.
That was very helpful.
Okay. By the way, we spoke about hatafas dam bris if it's me'akev. Well, I think we all assume or agree it's not me'akev, but the question is, if there's no bleeding whatsoever, do we do hatafas dam bris afterwards? So I did find in Igros Moshe where he says, Ulai tsari hatafa dam brit, where Moshe has the, Zatzal has it as a tzarach iyon. I'm just going to start reading again from inside, but we're going to mostly explain from the middle. Gimel. Keitzar malin. So how do we do this? We chotchin et orla. We cut the orla. Kol ha-orla. The entire foreskin. And right now we're assuming the outer layer of foreskin, because normally the way it was done, as far as I know, for hundreds of years, is there was no probe to separate it. Again, no one knows for sure what was done, but as far as we know, probably they never did any kind of a separation. Maybe there's discussion. But anyways, so let's assume there was never any probe or separation of the or Priah before you start. So all you do is you pull forward on the foreskin, right? You pull the foreskin, you slide in your shield, your magen. Again, magen was created, that's shield, to make it virtually impossible to cut any part of the glands or the atara. As long as it's, we learned yesterday, maybe 1 to 2 millimeters thick, you're never gonna, he said 2 millimeters, it's never going to fit through. If you start making it a little bit wider, then part of the glands or the atara can sneak in, and that's a problem. So then you can always cut. That again was created maybe, maybe 300-400 years ago, as far as I know. But anyways, they would just pull forward. The only thing that would come forward is the outer layer, because the Priah, the or Priah, the inner layer, kind of stuck a little bit. Now, it wasn't completely stuck, but it was kind of stuck. So it stuck to it. In other words, it wasn't like one, obviously it's a separate layer that you can peel apart. But it's basically, it was attached to it sort of, some kind of adhesion or whatever it is.
But if you use the probe, then it should come up with...
Exactly. So they didn't use a probe. So they pull on with the foreskin. Only the outer layer lifts up. You cut that, and then you are left with a full layer of the Ora Priah on the inside. So that's, again, and every aver is different. Everyone's anatomy is slightly different, not so different. But anyways, that's basically the idea. Right? Just like we all look differently and our fingerprints are differently, every part's a little bit different. Fine. So now we're left with the Or Priah. Kola Ora Chofe Atara. So you removed all of that layer. Ad Shetit Galeha Atara. You want the complete Atara all the way down to the Charitz, that groove, the sulcus, to be removed completely of the Atara. We're going to learn shortly in the next couple simanim what are tzitzin hame'akvin. Tzitzin hame'akvin is just leftover foreskin, right? There's no difference between tzitzin hame'akvin and the or orla. It's exactly the same thing. It's just an expression for leftover. Tzitzin milashon, like it sticks out or it sticks up. So leftover pieces of any tissue tags or pieces of the orla that's protruding, that's been left behind.
When you say atit galeha atara, that means the atara with the or Priah on it.
Yeah, the or Priah is still on there, right? Unless you removed it with a probe and cut it all at once. And then we mentioned already that you're going to cut it, whatever's left, you rip it down, and you either remove it or just fold it down. Umachziro lakanu lakan. And you just fold it down and push it all the way down below the sulcus, this way and that way, so now it's on the gid, it's on the shaft. Ad shiyira basar atara, until now you actually see the actual, the glands, the atara itself looks a little bit differently. Okay. Ad shiyira basar atara ve'achar kach. Now, this is motzitzin ha-milah. Ad sheyetze hadam me'amakomot harechakim. Metzitza just means you put your mouth over the entire thing, all the way down to where you cut. Right? You put the mouth over so you pass where the incision is, where the bleeding is, and you suck in a little bit so that all the blood moves a little bit forward. It has to be a little sucking motion. And then that's how we accomplish metzitza bepeh, with the mouth. And this has always been Kedei, actually the Shulchan Aruch himself writes, Kedei shelo yavo lidei sakana. Again, most hold, this is a lot of discussion and ink written on the topic, Metzitza b'peh, metzitza b'shvoferet, with a tube. We're going to mention that. Pretty much everyone agrees that metzitza is not an integral part of the Milah, halacha l'Moshe Misinai. It is not. That's what most assume. It is only because of sakana. Now, it is unclear when did it start. Was this from Moshe Rabbeinu? Was it from later on? But it's not an integral part of the mitzvah of Milah. That most agree. Not there is an Inyan up Kabbalah, so maybe it is somewhat about. It's more effective to use the mouth to matek, to sweeten the dinim and to remove the klipos. But as far as halacha sefer is concerned, hilchas Milah, generally we assume there is no halacha of metzitza, of sucking. It's only because it was assumed if you leave all the original blood there, it would be more dangerous for the baby. It's safer to have some of it removed, sucked out. And it would help with, to lessen the sakana for the child. It bleeds out. Right. So, it's actually interesting medically. Sometimes it's not necessarily better. Like a person gets a wound or they're afraid they'll get infected. Sometimes with medicine, I don't know. Maybe it's a debatable. Some say it's not better to squeeze out blood. So I don't know. Let's just read on. So then, v'kol moel she'eno motzeitz ma'avirin oto. And the clear halacha is, any mohel who does not do metzitza, we remove him. It's asr not to do metzitza. It's part of our Masorah for sakana, and it's an integral part of the bris milah. It's not necessarily halachically part of the mitzvah deraisa of doing a bris milah, but it's certainly part of our Masorah, and part of our Masorah is anything that Chazal says mishum sakana, we are very machmer to keep to it and not change our Masorah. Okay. V'achar, we're going to explain again a bit more. So, v'chol hamoel she'eno motzetz ma'avirin oto v'achar shematzatz, after he sucks, notein alea asplanit, then we put this bandage, gauze, whatever, or a tia, o avak samim ha'otzrim hadam. And then what this does is, you put on some powder, and then you close up shop, you put the bandage on, and you put on the diaper. So, this is what's always done. Now, first of all, when it comes to metzitza, normally, moalim nowadays, as far as I know, they all rinse before, or at least they're told to rinse before. Usually they will do either some kind of a Listerine rinse, or something with chlorhexidine, rinse for 30 seconds, and spit it out. Some write about having some wine in your mouth, dry better than sweet. I don't know, ask your moel what he does. Some, they have a little bit of wine in there, but obviously you can't have much or you can't really suck. Or some, they have a drop of wine that spills out on the aver before they suck, and then they suck. It's hard to suck when you have liquid in your mouth.
That's wrong.
So anyways, different moalim do different stuff, but certainly they should rinse out or brush their teeth, do something along that, floss, make sure their mouth is clean, and then they should do it. What else?
They don't have AIDS. Make
sure they don't have any diseases. We're going to talk about that in just a moment. Then, many moalim, they just put on some powder. It's either for anticoagulant, maybe for anti-infection. Usually it's for to help to stop the bleeding, as we see over here. It also helps, or some put some kind of iodine or some or neosporin, some kind of an antibacterial cream. Anyways, different. Do they put it on the bandage and they put it on? Different moalim do different things. Now, usually they just use a regular bandage, but sometimes if there's a worry about too much bleeding, some babies are more of a bleeder than others. Sometimes it depends on the cut. Sometimes, whatever the situation is, sometimes they'll put on some kind of a Surgicel. Basically, it's like a little bandage, but it's to stop bleeding. It's used for by physicians or dentists, and that helps to stop the bleeding. So basically, it's an anticoagulant bandage, and whatever is needed. And it's not an anticoagulant. You want it to coagulate. Oh, I did say anti-bleeding. Whatever, you want it to coagulate. All right. Anyway, so that's what's used, and in general with all bandages, anytime you put a dry bandage on a wound that's bleeding, and you want to leave it there to stop the bleeding, that's usually a bad idea if you do it just like that, because then when you come to remove it, it'll bleed on you. It'll rip it. So what's recommended is if you're going to use a bandage to stop the bleeding, make it moist. Make it a little bit wet, squeeze it all out. I mean, that's just me talking as a dentist. And so that it doesn't stick to it. You put it where you want it to bleed, and then this way you remove it. It's not going to stick and cause problems. Here, the powder can help for that. The Neosporin can help for that. Often Moalim will tell their baby, the parents or the child is to pour baby oil. And that also is healthy, and it keeps it so it's moist. So this way, when you remove the bandage, let's say they say after 24 hours or whatever the mole tells you, 1 or 2 days, you remove the bandage, you change it. I think I usually hear 24 hours. Then you'd make sure there's baby oil there. So this way, it's wet, and so this way it won't stick. But you want it wet really from the beginning. If you at the very end, it doesn't help as much as if it's wet from the beginning. So they don't put the oil on right away. When the mole is there, he doesn't put on the oil right away. That's for later on. Every time you're changing the bandage, so it doesn't stick. Okay, right. So we discussed that's what they do. Now, we mentioned the probe, the mafri. That's what separates it. And often, sometimes Moalim will use a mosquito or a hemostat. Mosquito is just a very fine hemostat. That's to take a clamp. It looks like a scissor, but at the edge it doesn't cut. It's just a clamp. So they use that if they want to grab it. So some use it, some don't use it. Many will use it if there's only like tissue tags that they need to hold on to, so it's more difficult. So let's talk about Milah uPriah bevas achas. So do you want to remove both levels of skin at the same time, both layers of skin at the same time, the or Milah and the or Priah, or do you want to do it in 2 different times? With the same slice. So, right? So the way we write in the Shulchan Aruch, it's 2 separate actions, and that's generally been the custom it's generally been the custom how it's always been done, and therefore, so I'll tell you, Rav Moshe on the minority. If you read most. I'm not sure what most Moalim do. I think most Moalim do it in 2 steps. Most of the poskim, they say you should do it in 2 steps because that's the Minhag Yisrael. That's the only reason. Minhag Yisrael, we see there's 2 steps and there's an inyan to use your nail, Al Pi Kabbalah, whatever. So that's, it's brought down, for example, in Yabia Omer, Yoreh, Chelik Zayin, Kaf Bet, and Shevet Halevi, just 2 random sources. But again, many speak about it. In most circles, that's generally in most poskim, that's generally what's recommended. However, there are some who do recommend to do it all at once. And, for example, in Igros Moshe, Yoreh, Chilak Aleph Kuf Nun Hey, and in Gimel Tzadi Chet, he double downs and he says it again. That he holds it's 100% lachatchila to do it bevas achas. How do you do bevas achas? You make sure you use that probe and you separate the entire or hamila from all the way down to the sulcus, completely all the way down. And then you'll be able to pull the whole thing together. Because if the priya is separated from the glands, from the atara, then you'll be able just to pull the whole thing all at once, and then it helps to use that hemostat. So you grab it all the way down, and then you pull right to where the sulcus is, and then you know exactly where you are. You can also use a pen mark, but this is the best way to hold it and to get it all the way down. If you want to do 1 cut and be done without any tissue tags to remove, I mean, there's often a little bit of tissue tags to remove if you want it to look better, depending on the case. Sometimes, I don't know. But so anyways, you grab the whole thing, and then you do 1 slice. So that's Igros Moshe writes, it's mutter lechatchila, and now some even point out that there's a tshuva of Rav Hai Gaon that says this was the custom in Bavel. In Bavel, that everyone used to do, or it was the custom. Again, sometimes when you see the word the custom, as Rav Moshe and I had a little, anyways, many times when people write the custom, it means that's one of the customs. In other words, it is a custom, it's done, maybe the minority of the time, doesn't matter, but it is such a custom, and people sometimes write, this is a custom. Okay. But Rav Hai Gaon says this is the custom. I would assume usually most... to do the whole thing b'vasachas. And some want to say maybe it's not really, it's a ziyuf, it's not really his. And Ramosha writes in there, I'm sure it's the real thing, it's the real Rav Hai Gaon, and he wrote it. Why? Because I found, according to Ramosha, the Yerushalmi says that was the minhag, to do it b'vasachas. So the Igros Moshe says there's no reason not to. It's clearly mutter l'chatchila, and that is the custom. That used to be the custom among the Jews, and according to the Yerushalmi and Rav Hai Gaon. And when you see the poskim who discuss that it's a new minhag to do it all at once, it's never been done before, the poskim don't discuss this Rav Hai Gaon and this Yerushalmi. So that's just an interesting note. Okay, but most molim will make sure even if they do a probe to remove, I don't say most, many molim, also, a lot of this depends a little bit if you're in the more yeshivish Haredi circles or the more modern Orthodox, or certainly if you're doing brisim for non-from families. So the minhagim change a little bit. But anyways, if you want to make sure you leave some priya behind, either you don't do a probe at all, or you do it, let's say, halfway or partial way. So this way you remove some of it, helps, and then you have less to remove secondarily with your nail afterwards. Can you use this probe on Shabbos? We're going to get to Shabbos later, but can you use this probe on Shabbos? So some say it's on the level of a heksher mitzvah. It's not necessary, and the isser is it might cause bleeding, because depending on how carefully you put it in and how much it's stuck, so it might cause bleeding. So some poskim say it's better not to. I think most say, a lot say, that it's mutter lechatchila as long as you are careful and do it gently, because then it's no longer a psik reisha. Again, it depends on your hands, if it's a psik reisha or not, but hopefully it's not a psik reisha, and therefore it's okay. And I even saw, as pointed out by, I think it's Rav Avadia, that he quotes Tosfos, writes, interesting shita, we don't usually follow it, lahalacha, at least not by itself, is that a psik reisha delo nichale letzarach mitzvah is mutter. Usually we say once it's a psik reisha, it's 100% asr, maybe only derabanan, but we say not to do it. But anyways, here that was just as an added sniff, but really you do it carefully, and usually it's not going to be a psik reisha.
Even if it were psik reisha,
if it's a psik reisha, we would hold. Some would say it's aser, and because we don't follow that Tosfos usually as a one daya, it's not lahalacha by itself, and so then it might be a problem unless you consider it part of the Milah process. So we know that Milah is docha Shabbos. So we're talking about the probes. I wanted just to mention it right now.
Even during the week, you should be careful not to close the...
Right. Let me finish the Haggah, and then the one last topic I might say today is mitzitza. We learned you have to do a sucking with mitzitza b'peh, to suck some blood out. The question is, can you do it not with a peh? Can you use a sponge, or can you use a glass tube? So let me just finish the Haggah, and we'll see if I mention that quickly today. Haggah, v'yeh nizhar im yesh laspanit safa shevchenu lachutz v'lo lifnim shelo ledabek b'makav yavo lidei sakana. So he's just saying they had this bandage with if it's folded over, you had like maybe a little bit of a seam. What's it called? A hem or something like that. You want to just make sure that's on the outside, not the inside, because then it can get stuck and cause damage or make it bleed. It can cause infection. So, anyways, we don't really usually have that. But also, when you fold over your bandage, whatever, I don't know. Okay, so that's the Ramah. Let me just mention it real bekitzer, mitzitza bishvoferet. That's a big topic in the poskim, and a lot's been written on it. I'll just say like this. Again, most hold mitzitza is only because of sakana. And the first who wrote about it the most, I think, famous, to say that it's mutter not to use mitzitza b'peh. Again, the concept of mitzitza is brought down. That's I'm not even sure where the peh actually with the mouth first starts. I mean, that's how it was done. I'm not sure where that's first mentioned. Certainly mitzitza, having some kind of a sucking motion has always been is the ikr, and that's what always been mentioned. And it's just to draw out blood. So the Chasam Sofer is the first who writes that it's mutter not to do it with your mouth. You can even just use a sponge. And So who else holds like that?
I thought that's only it was because there was a
So the Chasam Sofer, they asked, there was a disease at the time, and they asked the Chasam Sofer, what should we do? And he said, don't use your mouth, use a sponge. So he has two Talmidim. Now this tshuva, I'm not sure why, it's also a question. It wasn't in his main tshuvas, it was kept outside, but his children, they all testify that it's an accurate tshuva from the Chasam Sofer, his Talmidim. He has two of his main Talmidim was the Maram Shik, and he says that Chasam Sofer was only Hara'at Sha'at, should never be used again, and because the minhag is to use the mouth, and the Yad Elazar says, no, that's lechatchila, to use a sponge. And it's brought down in the Bir Halacha, that it seems, and I even saw some quote, like this Talmud or the son-in-law quote the Chafetz Chaim, that he did say that it was mutter to do it with a sponge, and it doesn't have to be with your mouth. It's the Bir Halacha in the beginning of Shin Lamed Aleph. He quotes two opinions, but it's mashma, it's lechatchila, you can do whatever you want. Either way works. And so, who allows it? So the point is, right, so some of the ones who are, I will say, most poskim, at least the written poskim, and certainly in the more yeshivish circles, Haredi circles, are going to say it's against the minhag, and it should not be done, unless the mohel himself knows he's not so safe, he might have herpes, he might have a disease, or you're afraid the baby has a disease. And that also depends on, you don't know who, depends maybe on the families. So, generally speaking, they will usually say you should only use, you should not use a tube or a gauze. What most do that don't use their mouth directly, they'll use a tube, not a sponge. Or they use a tube with a sponge inside, but you see blood comes out. There's sucking motion. You put it all the way over and the blood comes out. You see that. But some point out, you have to make sure you put it on all the way, whatever, so that you're not just getting blood by touching it. You want there to be some sucking motion. But generally, so most written poskim will say it's better to do metzitza bepeh, not with a tube, but whenever there's a chashash, sakana, so then they say it's mutter. And again, it depends every tshuva is a little bit different. You see their wording. Some are more vehement against only using their mouth and not a tube, and some are like, well, it's better, that's our minhag. But that is more the majority of the opinion. For example, we mentioned the Maram Shek, Avnei Nezer, Ben Yitzion, Chazon Ish, Shevet Levi, Yalkut Yosef, Rav Elyashiv, Hashom Zalman Auerbach, they all say it's better not to use a glass tube. Who says it's mutter lechatchila to use a glass tube? So the RCA, Rabbinical Council of America, that's Rav Shechter and Nefesh Harav, and he writes that also the Rav, and the Rav's family, the Brisker Rav, Rav Chaim Soloveitchik, Rav Moshe Soloveitchik, they were all known to only use a tube, they wouldn't let them to use the peh. We mentioned the Yad Elazar, we mentioned the Bir Halacha, Rav Elchanan Spector, Rav Tzvi Pesach Frank and Har Tzvi, a couple other sources, not so much poskim, but still, Melkor Baruch, Tiferes Yisrael, they're the ones who say it's mutter lechatchila. Ramosha, I did not find out. I did not see, and I didn't find out in time. I asked Rav Meiselman. He said the minhag by all the briskers nowadays in Soloveitchiks is to use metzitza bepeh for the ones who live in Israel. Because Mashana Makom, this is the minhag of Makom. And so that's what they do. He didn't want to get into the history, his family history, or going back to Europe or America, but that's the custom.